I've had the honor of knowing them as friends. Her and her husband Mike, their son Arian works for us now. I've been a patient of Dr. Shaban's. Amazing doctor, has helped me a lot personally, a lot of our clients, my family, and some of you here that are probably patients of hers. And so we just feel very honored to have Dr. Shaban with us today. Let me just give you a quick little rundown of her bio here. She's a triple board certified physician who has maintained a successful practice here on the Central Coast for 20 years. More lately, she's attracted national attention due to her many television appearances and her thought leadership role in the practice of functional medicine. Dr. Shaban has been featured speaker at corporate and educational events for organizations such as Microsoft, NASDAQ, and Harvard University. She is also the author of an internationally best-selling book, The Fountain of Youth and Eternal Health, and it is an amazing book. Some of us here have read that. So help me please welcome to the stage Dr. Laleh Shaban.
That was quite an introduction, thank you. All right, we're going to do a quick exercise. So I'm going to have everybody stand up for a second, and you're going to do what I do. And when I stop, you're going to stop. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, cool, sit up. All right, this exercise was for 3 reasons. Number 1, to keep you on your toes. Number 2, to get the blood flow to your brain so you can get more out of it. And number 3 is to find out if you have urinary incontinence. That's part of my talk today. I recently spoke at Harvard and I got a chance to interview Caitlyn Jenner, formerly known as Bruce Jenner, 1976 Olympic medalist. And I asked Miss Jenner, what was the most challenging part of your journey in becoming a woman? And she said it was hormone therapy. She said when I was getting my hormones, I had to lock myself in my house for 5 years because I was so emotional. I was crying at a drop of a hat. And as a man, I never experienced such roller coaster. This is a man who became a woman, who has had emotion as a man and emotion as a woman, and is telling us that as women, it's really hard for us because our emotions are like roller coaster. Yeah. And actually that's quite true because here we start at menarche, way back around age 12, and we start having all sorts of emotional ups and downs. We are having our first menstrual period. We are 1 week out of the month. We are doubled over with a heating pad and a Midol by our bed. And we feel bloated, we have acne, we have low self-confidence, and of course, we have this emotional ups and downs. At this stage in our life, our parents don't know anything, and our friends are so mean. Let's go to, then everything settles and pregnancy hits. And with pregnancy comes all sorts of other symptoms. Of course, we have nausea, vomiting, we're growing from every direction. And we have joint pain, we can't sleep at night, we're constipated, and we're going to the bathroom all the time to urinate. And it's not fun, and a lot of mood swings again. Then comes labor. We are so stretched that we are like Incredibles. We're actually the Incredibles. Then comes postpartum. We are depressed. We're thinking about this beautiful creature in our hands, thinking, am I going to be a good mom? Am I going to provide for this child? Is this child going to be normal, healthy, and all that? And of course, we're not sleeping, and we are going up and down with our emotions. And then there's a video clip, so how can I get that going? And the child grows up, and the child is curious and has questions. So I'm going to let you guys watch this for a second.
Yeah. How would a baby even come out of there?
Well, that is a very good question. Something that you do not need to worry about for a very long time. But the body It's magical. And when there is a baby in there and it's all grown and ready to come out, your body knows to make your vagina hole get really, really, really
You have a huge vagina?
put back in the bottle. Almost too small.
Everything starts getting better. The kids grow up and the menopause hits. And with menopause, we have a ton more symptoms. This is when I have my patients come to my office, and I'm sitting on one side and they're sitting on the other side. Usually they bring their spouse. And I go through this questionnaire and I ask them to give me a number from 0 to 10 as far as where is their symptom. 0 being no symptom, 10 being the worst symptom ever. And I show the mood swing. I'm like, well, what about the mood swing? And the patient is usually, Dr. Shaban, that's it too. And the husband in the back is and then I say, okay, go through some more. How about irritable? Oh, Dr. Shaban, that one is a little bit more. Yeah, I think it's a 3.5. And the husband is like, so the reason I'm saying that is because sometimes we don't even know we're having all these emotional roller coaster. It's not us. We think we're being sweet and lovable. We have no idea we're 50. I'm irritable. And it's the loved ones. It's our husband. It's our children, our friends, our neighbors, our co-workers, our boss. They are feeling it a lot more than we are. Now I'm going to see who can relate with this. Oh, I know her name. I know who she is. I know who she is. I know her name. Or if you guys have this symptom, oh, I came here for a reason. What was it? I needed something from this radio. What was it? Or where are my keys? I got to get the kids to the game. Or you come out of the store and you don't know where you're parked. Well, if you have any of those symptoms, I just want to tell you, you do not have Alzheimer's dementia. Mostly you're suffering from some hormonal imbalance. And it would be good to see your physician for that. I'm going to talk to you about urinary incontinence and urgency because that's a major problem. 67% of postmenopausal women in this country suffer from urinary incontinence. You know why? Because it didn't snap back. So, and women are really afraid and embarrassed to talk about it. And it's just so secretive for them. They don't want to share it with their physician. They don't want to share it with their friends. They feel like they're alone. I'm here to tell you ladies that you're not alone. 2 out of 3 of you has it. They're not going to tell you, but they do have it. And what are some of the things that happen with urinary incontinence? Is you cough, you sneeze, or you laugh, and you have to cross your legs. And that's embarrassing in public. How about this one? You have to give up yoga. You have to give up jogging, dancing. And I have patients jumping on trampoline. I ask them to jump on trampoline simply because when you jump on a trampoline for a few minutes, you get cardiovascular exercise. You also get lymphatic drainage and, of course, bone building. And so it's an exercise that I ask my patients to do, but a lot of them, when they come to me, they cannot jump on any trampoline. They have to hold themselves, and that's not good for their balance. And I have executive women who are in the middle of a huge transaction with their client, like $1 million, $2 million, and they have to drop everything and run to the bathroom. What will happen if they don't make it? This happens. And it's quite embarrassing. Now, I also want to tell you that newer studies shows 1 out of every 4 teenage girls has urinary incontinence. That is incredible. And why? You may ask why. Well, that's because of our environment. We are living in such a toxic environment that is all these toxins, chemicals are interfering with our hormones. And there are BPA, like BPA is in plastic. So when you drink out of plastic bottles, you're getting some BPA in your body. If you're storing your food in plastic containers, you're getting BPA. BPA is not only what we call them xenoestrogen. Those are chemicals that act just like our own estrogen. They get in our body, fool our body, and they act like they're our own estrogen, and they cause all sorts of disruption and difficulty with balance of our body. So BPA in plastic, avoid it, drink water from your glass, and store your food in a glass container. Parabens are potions and lotions and makeup. So when you go to any kind of department store, if you look at the cosmetic counter, you're going to see all these teenagers putting stuff on, lotions, cosmetic, perfume. Just know that skin is the largest organ we have. And we do absorb through our skin. So you do want to let your teenage girls know that they are getting some BPA, some xenoestrogen, which is interfering with their hormones. And of course, pesticides and herbicides. So I do recommend, if you can, eat organic. What are we going to do about it? Okay, so I've told you all these things, but what are the options? So there's, of course, first option is to detoxify. As I said, our environment is so toxic. We don't have much control over the environment, but we do have control over our reactions to the environment. So we ask our patients to get some IV therapy. We do have an IV center in our office, in our clinic. Protein shakes such as detox shakes, detox supplements, and HARCAT. Regenesis 360 has HARCAT in this county, which is great for getting rid of a lot of toxins through your skin, especially heavy metals. And then we have colonics. How about medications? Mainstream medicine way of dealing with anything is through medication. And medications have side effects. The most common side effect of urinary incontinence medication is dry mouth. I have patients who come to my office, they have their bottled water in their hand, they're sipping, and they're trying to talk to me, and they're like, we call that cotton mouth. And of course, sometimes you know the side effect of a medication right then and there because it happens, but sometimes it takes years for that side effect to happen because every medication you guys take depletes your body of some nutrients. And sometimes you may need 6 years of that medication to be so depleted to have that side effect. For example, leg cramps. If you take a urinary medication today and 6 years later you have leg cramp because of it, there's no way you know that, oh, I got the leg cramp because 6 years ago I started such medication. And surgery. Surgery is, of course, has risks. Surgery is may not work and also has downtime. And then we have OSHOT. OSHOT is what we do in our clinic. What OSHOT is, we actually draw your blood in our office, we spin it in that centrifuge right there, and then we take your growth factors called PRP or platelet-rich plasma and inject it into your vagina. Don't worry, it doesn't hurt because we numb you. And when we do that, what happens is we cause an inflammation. By the way, it's really effective. We call that, it's really fast. We call it a lunchtime procedure. It's painless and you can go back to your activities. So a lot of women come in at lunchtime and get this procedure and leave, and they can do everything, including having intercourse the same day. We do tell them to avoid horseback riding or bicycling because it can be slightly tender. You should avoid any kind of anti-inflammatory medication. And the reason for that is because when I take your growth factors from your blood, from your own blood, and inject it into the vagina, I'm causing inflammation. Inflammation causes your cytokines and chemokines, these are the soldiers in your blood, to go there to evaluate and see how much damage there is. And then they will call in the troops, backup troops, which is your stem cells. And they come there and start healing and suddenly you have rejuvenated organs, fibroblasts, and collagen. So this procedure happens with any part of our body. So you've taken that part of the body, taken it back almost 10 years and rejuvenated it. I'm going to talk to you about one of my patients. We're going to call her Mary. Mary came to me on a Friday afternoon to my clinic, and she got this procedure. Mary had severe urinary issues. In fact, her life was consumed by her urinary problems. And when Mary came in, she was telling me that she had tried surgery, failed. She had tried medication, had lots of side effects. And Mary didn't stop, and she didn't quit. She continued to look for an option, and she found out about OSHA and came in. Well, Mary was telling me that she cannot leave the house, so she only goes for doctor's appointments. And every time she goes out of the house, she has to take multiple stops for bathroom breaks. Mary and her husbands were not eating on the same table because she would get up so much, it was irritating. And he wouldn't sit next to her on the couch, and they wouldn't even sleep in the same room. Mary was giving up on that marriage. That day when I injected Mary, she went home, and she came back the following Monday, really tearful, and she didn't have an appointment, and my staff told me about it, and we put Mary in a room, and I walked in thinking she was going to say, Dr. Shaban, this procedure didn't work. And I was ready to tell her it can take up to 2 months for some patients, so be patient. When I walked into the room, Mary ran and held me really tight and started to cry. I stood there, and then within seconds, she started to speak. She said, Dr. Shaban, when I left your clinic Friday night, I went straight home, and I didn't take any bathroom break. And then I thought to myself, it's probably psychological. And then when I got home, it took 4 hours for me to urinate, and I thought, is there hope? But I didn't want to become hopeful because then I would get disappointed. And then the whole weekend went by. That night she slept through the night. Usually she would wake up 3 to 6 times to urinate. And then she's tossing and turning. But that didn't happen that night. The whole weekend went by, and she's urinated like about every 4 to 6 hours, just like she used to 10 years before. And she said, last night, my husband and I sat on the couch together. We talked about good old times. We laughed, we held each other, and we cried. And this morning, he booked us a cruise. I'm here to tell you, you saved my marriage. You gave me my life back. Thank you. And Mary's story, I want you to take 2 things from Mary's story. Number 1, there are going to be so many options out there that no physician will tell you, so you would not know that those options are there. So you need to be proactive, you need to research because there are other options. So when your physician says you should be on medication or surgery is the only option, don't settle for that. Get more opinions. And number 2, know that we have the OSHA, we offer that. And our clinic, we can answer any questions. It's quite successful. But most of all, I want you all to get information. Knowledge is power, but applied knowledge is even more powerful. Thank you.